Starting in 2014, the Affordable Care Act will require most Americans to have health insurance. For those hoping to get insurance through employers, some important news. Businesses with 50 or more employees have been issued an extension and will not be required to provide health insurance until 2015. If your employer chooses not to offer insurance, you may be able to apply for subsidized coverage. According to a Gallup poll, not everyone is aware of the new requirement, which is also known as an individual mandate. Although the poll showed most Americans were familiar, 43% of uninsured Americans, the population who'll be most affected by the change, were unaware of it. Whether we're prepared or not, the change is coming. Here's what'll happen if you fail to meet the requirement. In 2014, an uninsured adult will be asked to pay the federal government $95. The penalty for an uninsured child will be $47.50. It could be up to $285 for a family or 1% of the family income, whichever is greater. Following 2014, the penalties are scheduled to increase. In 2015, an adult without insurance will pay the federal government $325. The fine for an uninsured child will be about $160. In the years following 2015, the penalties will increase to about $700 for an uninsured adult and about $350 for a child. Although the requirement to have health insurance will apply to most of us, there are a few exceptions. People that have to pay more than 8% of their income for health insurance. People that have a family income below the threshold for filing a tax return. People that qualify for religious exemptions, undocumented immigrants, people who are incarcerated, and members of Native American tribes. You can also apply for a waiver asking not to pay a penalty if you don't qualify automatically.